Hello everyone, my name is Ryan, and today we're going to be going over allergic reactions in adults in pediatrics. Now, we're starting off at the beginning. What is an allergic reaction? The actual definition of allergic reaction is going to be an adverse immune response to a harmless substance known as an allergen. That basically means that the body can react to allergens in a variety of different ways. Just because I'm allergic to something doesn't mean you are, and if we're both allergic to the exact same thing, doesn't mean both of our bodies are going to react the exact same way when it comes to having an allergic reaction. Symptoms can range anywhere from itchy, watery eyes to, swelling of your airway, increased heart rate. You could have redness, swelling. You could have hives. Again, it all really depends on the person and what their response to the allergen actually is going to be. Like I said, different responses to different body parts. Your skin, your GI tract can be infected. You can have cardiac issues. You can have respiratory issues. You can have a whole bunch of different issues depending on how your body wants to respond to the allergen. Now, some of the most common allergens that we're going to see are going to be food. We'll have milk, eggs, peanuts, soy, wheat, gluten. Gluten's a huge one right now. Like, I know my father personally he has celiac disease, so he can't have any type of wheat or anything that comes in contact with wheat. When he actually does have it, it swells up his GI tract and it causes a whole bunch of issues. Fish is another one. For environmental, we have pollen, dust, pet dander, mold, and insects. We have our seasonal allergies, which most of us have. Itchy, watery eyes. We take a little bit of Benadryl, some Zyrtec type of a thing to counteract those. And then we have some other allergens that we'll have. Some people are allergic to latex, which is why we have nitrite gloves in all the ambulances. Some people can be allergic to medications. For instance, I have a sensitivity to Flexerol. I have to take a half a dose of that, or it will knock me completely out for the entire day. Perfumes, even if you spray it on your body, you could be allergic to it, or even if you're just walking past somebody and you can smell it, you can be allergic as well. And then chemicals. Chemicals, again, if you get it on you, if you ingest it, if you inhale it, there's a whole bunch of different things. Now, with allergic reactions, recognizing them is going to be one of our biggest and most important part of our jobs as an EMT. We have, mild, moderate, and severe. For mild, like I was talking earlier, we have sneezing, itchy, watery eyes. You can get a rash. We have a little bit of swelling, some GI comfort, so some stomach pain. When it gets into a little bit more moderate, we can have rash and hives, facial swelling, which could start off at the face and then could start causing breathing issues. Asthma, people can have asthma really quick, and for asthma, if they do have it, usually they'll have a meter-dosed inhaler or an emergency inhaler that they can use in case they have any type of symptoms. Nausea, vomiting, dizziness again as well. With severe, you can have airway obstruction when everything just starts to close up, which is going to be anaphylaxis, difficulty breathing along the same lines, rapid or weak pulse. Your body is trying to fight the allergen, so it's trying to pump everything through your system as quick as it can to get to those spots. So you're going to have your increased heart rate, dizziness, or even fainting. Once you get to that point, you're also going to have a drop in blood pressure, which is going to be shock, because your body's trying to do all this stuff at once and it's trying to fight what's going on. So it's going through a lot of different steps all at the same time, and it's basically taxing out your body, so it's going to drop your blood pressure. And now for us, the best thing for us to do is have a very good assessment of that patient. Patient history. Has this ever happened before? What are they allergic to? If they know that they're allergic, do they have an EpiPen so we have a way that we can actually help them and treat them? On top of just being able to get their history from it, rapid physical exam. Do they have the redness? Do they have the swelling? Do they have hives? Do we see any swelling in the throat area or the face or their eyes? And then with assessment, accurately documenting all of the findings. So taking really good notes, making sure it's all notated in your run form, making sure you have all your information before you kind of move past that spot so we can understand what's actually happening and be able to pass that information on to the next higher level of care, either the doctor or nurse, if there's a medic on scene. Now with consent, we have expressed, implied, minor consent as well. Express consent, basically, if somebody says, hey, look, I'm allergic to this, I need help, can you help me? Implied consent is, if they're in anaphylaxis, they can't talk, they're not breathing, there's no way that that patient can actually communicate to us. It's implied that we can assist them, we can help them and try to get them better. Also, we have a lot of children that are allergic to stuff. Now, when we have children that are allergic and we go, just like any other call, if there's a patient on scene, or if there's a parent on scene or a guardian, make sure we talk to them as well. Can we treat your child? Can we treat them? What are they allergic to? If we can't get if there's no parent there on scene, depending on the issue, again, if it's severe, it will fall under implied consent, so we can do what we need to. And then we also have refusals. We could go to a call for an allergic reaction. They could be like, oh, this happens all the time. I get itchy for a little bit. I just took some Benadryl. It'll be done in 25 minutes. I just called you just in case. I didn't know how bad it was going to be. So I'll sign the refusal. You guys can go about your way. Now, with these allergic reactions, we do have our emergency interventions. Epi or epinephrine. It's going to be it's a hormone for adrenaline, and it's actually made in the adrenaline glands. So epi, we use either through an EpiPen, or depending on your state and your protocols, we can do the check and inject, where we actually will draw up the epi in a syringe and be able to give it in their lateral thigh. Also, we could always have to think about oxygen. If they're not breathing or they have shortness of breath, you can always put them on a non-rebreather. If it gets to a point where it gets really bad, we can do advanced airway adjuncts mixed in with oxygen. Sometimes we might even have to use a BVM if they're really bad. Antihistamines, again, depending on the state and your training, you can use Benadryl. Like, I know paramedics can give Benadryl, and they have a couple other things in their med bags that they can administer that EMTs can't, that can help with the allergic reaction depending on the severity. Also, positioning the patient is a nice, simple, easy one. If they're tripoding, have them stand up, or have them sit down and try to open up their airway and take deep breaths and try to relax them and put them in a position that is comfortable for them, as well as being able to open everything up so they can breathe. And then transport. Again, it could either be rapid transport. We show up, we see somebody that's in anaphylaxis, we grab them, we put them on a stretcher, get them in the back of the ambulance, administer epi, and then we just fly off to the hospital. Or we kind of stay and play a little bit, see what we can do, get them situated. If it's not as severe, then we can do a nice slow transport to the hospital. Now, each state is going to have their own protocols depending on what you can and can't do. In the state of Connecticut, again, routine patient care is going to be number one. If they do go into anaphylaxis, for adults, they're going to get 0.3 milligrams in the lateral thigh of epi. For pediatrics, it's going to be 0.15 milligrams IM in the lateral thigh again, and that's going to be only if they're 25 kilograms or less. If they're over 25 kilograms, we're just going to give them the full adult dose, the 0.3 milligrams for even pediatrics. And again, it really depends on what our sponsor hospital says and what our med control doctor says. Sometimes we do have the option that we can administer it through a syringe, which is going to be the check and inject. Other times, you're going to have to use an EpiPen, but it really all depends on what your state says. Also, we do, again, have standing orders. Besides the standing orders, if we do need to provide them with more epi if the first dose didn't work, we do call med control, and then we'll follow whatever the doctor tells us to do on the phone. And again, we do not delay transport, especially if they're in anaphylaxis. Get them on the stretcher, get them in the back of the ambulance, fly to the hospital, go lights and sirens. And while you're in the back, do what you need to make this patient comfortable and being able to get them taken care of. Now, again, allergic reactions can respond in any way, shape, or form depending on the patient. I used to work at a local theme park, and probably within the first 2 weeks or so of us getting the medical department up and running, we actually had a younger female pediatric who was allergic to dairy go to one of our ice cream stands and actually received what she thought was sherbet, but it wasn't, and she had an allergic reaction to the ice cream. Now, mom was freaking out on scene. Bystanders were freaking out on scene. My EMT got called to the scene to get it taken care of. We had the epi check and inject at that point, so she was drawing up the meds, the 0.13 milligrams. She went to go draw it up, and she bent the first needle. Put the needle on the ground, grabbed the second needle, because there's always two in the pack, drew it up, gave it to the daughter. Now, after we gave it to the daughter, it was a very hectic scene that was going on. We later found out that apparently mom also gave the child's EpiPen as well, but mom never told anybody that along the lines. We found that out later on after we did more research and stuff and talked to mom after the child went to the hospital. So it was a very hectic scene. There's a lot of stuff going on. This EMT has never had to draw up meds before. So it was one of those things that we have to stop, take a breath, remember what our training was, and then be able to respond. If everything's going crazy around us and we start feeling that and we start going crazy as well, we're going to miss steps and it's not going to turn out well for the patient. So we were able to provide the epi for the child. We were able to get transport for that child, but mom didn't want to wait. So we provided epi. Mom took the child in her arms, left the park, got in her own car, and drove to the hospital. Now, at this point in class, I would have an open discussion with everybody and talk to them about what went right, what went wrong, some of the takeaways. Did we follow the EMT protocol? And now, needless to say, at the end of everything that happened, we did have to go through a little bit of disciplinary action with the EMT, as well as a little bit of retraining. The patient walked out of the hospital. Kid was fine. We had a little bit of paperwork and stuff to do, so it wasn't as bad as it could have been. But there were some key takeaway points from it. Like I was saying, if it's not our craziness, it's not our emergency, we have to be the professional ones on scene to be able to relax and remember our training so we can provide the proper care that we need to. But also we need to remember that if we ever provide any type of medication to a patient, we cannot let that patient just get in their own car and drive away. Because with that child, if something was to happen along the way from when she left the park, going over to the hospital and something went wrong, or she had some other type of an allergic reaction or a reaction to the epi, there could have been 1,000 other things that could have gone wrong. We actually lucked out with this because there wasn't anything detrimental that happened. But again, there's a lot that can go wrong in crazy scenarios, and we just have to remember our training, take a deep breath, and continue on. Hopefully you guys learned something from the allergic reactions for pediatrics as well as adults. Again, my name is Ryan, and I hope you guys enjoyed my presentation. Have a good day. Bye.